The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.
Most hair and personal care salons in Ontario have remained closed throughout much of this pandemic. And while they're briefly expected to be back at work this week, even in lockdown regions, they are not. Tonight, we'll hear from them about how their industry has been decimated. Then, our Ontario Hubs update us on how the pandemic is unfolding in their regions. Plus, from Ontario's vaccine rollout to whether political parties are bad for Canadian democracy, we've got the Agendas we can review. I'm Nam Kiwanuka. It's Friday, April 16th, and that's next on the agenda. Lockdowns have hit some sectors much harder than others. According to the Beauty United Council of Ontario, 82% of beauty industry businesses in the province could face permanent closure due to this pandemic. And of the 200,000 people employed by the sector, they also point out that 80% are women. The personal care industry is hurting. With us to understand how badly in Thunder Bay, Ontario, Isabella Forglia is the owner of Botanica Luxury Spa. In St. Catharines, Ontario, Paola Girotti, chair of the nonprofit Beauty United Council of Ontario and owner of Sugar Moon Salon, which operates out of Burlington and Toronto. In Pickering, Ontario, Sean Lewis, also known as Bucky the Barber, owner of Custom Cuts, that's located in Pickering and Whitby. And in the west end of Ontario's capital city, Norm Wright, who's a color technician at Taz Hair Company. Hello to you all.
Hello. Hello.
I joked before that I had to make sure that I kind of looked half decent for this panel. But all jokes aside, this year has been very difficult for your industry. I wanted to get an idea of what the past year has been like for you. And Isabella, as is our tradition, because you're the furthest away, I'll start with you.
It's been just absolutely unimaginably difficult, like just so financially straining, and we've been left with feeling just so unessential after all of this.
And Paola, how about you?
For me, I have two thoughts. One, personally, I'm obviously financially devastated. I'm also a single mom raising two kids. And so I have that parental aspect where my kids have been at home. And then I also have a team of 33. So professionally, I'm exhausted because we took on this role to really champion our industry with government. And it's been very difficult to work with the Premier after a year of closure.
And Sean, what about you?
I would say that it was very stressful, very, very stressful. And just not knowing when the doors are going to open, not knowing when the doors are going to close has been tragic for the mind and the mental for us, honestly.
And Norm, what about you?
We're all very, very terrified about what the fate of our industry is going to be after this. We have all tried to place logic on the decision-making process that our leaders are making, and clearly personal care hasn't been the culprit in this because we've been closed longer than any other sector on the continent. So making us bear the brunt of this has been very challenging.
I don't know if you had the chance to read the article from Matt Gurney, who's a journalist here, and he also writes for TVO.org. A couple of days ago, he had an article called "Who's in Charge in Ontario and What the HE Double Hockey Stick is Going On." I'm just going to read an excerpt from that. Sheldon, if you could please bring the board up. Matt writes, "There's plenty of other stuff to worry about to state the blindingly obvious. Ontario's ICUs are getting awfully damned full, and the impact of the latest stay-at-home order probably won't even begin to bring down daily case growth until next week at the earliest. We're in for a rough April and May. But the haircuts and patio story is still a small but telling hint that seemingly no one was paying attention at the highest levels as we plodded confidently and serenely into this disaster. Isabella, those are some strong words from Matt. Can you give us a sense as to how the lockdown has affected you financially?
Honestly, at this point, I'm at the point of bankruptcy. Like, I'm a new business owner. I'm 27. I'm in my second and a half year of business, and I've exhausted all of my savings, my husband's savings. We've got nothing left. And just to put things into perspective, I actually had my car repossessed on Monday because I've fallen behind with my payments and I've not received any type of funding from the government. I haven't even received the CRB, which is the $900 every 2 weeks. My application keeps getting denied, and I've been waiting since January to get a response back with the Ontario Mainstream Grant as well. So at this point, I've got nothing left to lose. I've lost it all.
I think people watching and listening, because I think we've been hearing this from the government, that there are supports for businesses and people should apply for these funds. There's money there and they should apply for it. But you just mentioned that you did apply for those benefits. Mm-hmm. You haven't received them. Your car was repossessed. You want to work, but you're not allowed to work. How does that feel?
It's just, it makes you feel so unimportant. And I've lost all of my motivation. I've lost all of my desire and my want to do anything. I'm stuck at home, and I never in a million years would have thought that I would have to beg just to go to work to make a living for myself. So to have to go through this at no fault of my own, and I know there's thousands of people in the same situation, it's mind-blowing because we put so much faith in our leaders, we put so much faith in their decision-making abilities, and we've been begging for months to lock us down hard. If they would have done this back in December when they had the the second stay-at-home order, then maybe we wouldn't be in the situation that we're in now. But we've sent hundreds of emails. We've called our premier. We've called our health minister with not even any type of respect back towards us to even answer our questions as to why we've been the industry that's been discriminated against.
Paula, I just want to jump off a word that Isabella just used, unimportant. You're the chair of the Beauty United Council of Ontario. Do you feel that that's how this government has treated your sector, as unimportant?
Well, I definitely think that there is a level of unfairness in how we've been treated. They have a real health crisis on their hands. And certainly I wouldn't want to be a politician, but I think that what we are trying to get across as a sector is that there is a level of unfairness and we are looking to be treated fairly. We've seen Premier Ford step up to the challenge with other industries, but we have not yet been treated fairly by him. And we are going to hold him to his word the other day where he was talking about our industry and saying, trust me, I have your backs. Well, Mr. Premier, if you are listening, we are waiting. We have a plan.
What is the plan?
So Beauty United Council of Ontario is now working with and partnering with Maxil, who is one of the leaders in dental hygiene and actually helped the dental hygienists actually get back to work last year. And because this government is so all about data, what we do know is that Maxil has the data that they've kept dental hygiene safe. And when you think about hygienists actually working in the mouth and all of the aerosolites that they create, our sector is nowhere near that type of high risk. And so yesterday, in fact, actually, we released this to the news to let them know that our sector is taking matters into our own hands to get the support of public health based on data from Maxil and how they've been able to champion dental hygienists. So after this call, I'll be reaching out to the two others. Norm and I work closely together on this mission, and we'd love to be able to help you.
Well, you mentioned that the Premier mentioned your sector a couple of days ago. We actually have a clip of that. This was this past Tuesday. Sheldon, could you please roll?
I look like a sheepdog, and so we literally got some dog clippers, and I got it on video to prove it, or I know you guys are going to want to see it, but my daughter that lives at home's never cut anyone's hair in their life. I just sat in the chair and said, honey, go to town. And, we couldn't even figure out how to work these clippers, and I grabbed them and zinged half my head so it's half bald on one side. And that's what happened. But, on a more serious note, my heart breaks for these barbers and hairstylists, that have been shut down forever. It really does. And I'm going to do everything I can to get you back open.
In fairness, when that clip was shared on social media, I liked it. I thought it was very cute. I thought this is such a nice moment. But then afterwards, I kind of thought about it differently. Norm, when you saw that clip, what went through your mind when you heard the Premier mention your craft in that context?
It's not the first time that's been mentioned like that. During the first lockdown, Medical Officer of Health Paul Romley-Otis, when asked about the personal care sector, said that it was suggested that it was more sanitary to stay home and cut your hair with dog clippers. And it's a testament to the lack of solidarity or compassion that this government, municipally and provincially, has for our sector. The contribution that hairdressers and personal care workers have given to our communities since their inception is vital. And I consider it an insult. And quite frankly, I would like to see that video. I would like to see him getting his haircut by his daughter with dog clippers. If they choose to keep referencing the quality of and caliber of work that comes out of our sector in that way, I'd like to see the video.
Do you think that's part of the reason why your industry has been dismissed as being non-essential? Because people just write it off as, as a vanity?
I think that our numbers as a group, as an entire sector, are too big for them to monitor. We don't have a governing body at this point. The Ontario College of Trades is who we pay our licensing dues to, and they are an umbrella for a number of different trades, so like carpentry and electricians. So the guidelines are non-specific. We have no one to answer to. So when I was invited to become part of Beauty United, I jumped on board with both feet, because when the initial lockdown was first announced, the government gave us guidelines to follow, signage. We've all been able to put all the proper precautions in place to ensure our clients' safety, and they don't recognize it as credible, and they gave it to us. So when Paula approached me with the new IPAC certifications that would give us the same infection prevention control as dentists have, that is a one step in getting us to a table where we'll be respected and taken more seriously.
We've talked about the financial toll, Sean, but what about the personal toll? How does that contribute to what's happening this past year?
The personal toll, I would say, just a lot of stress, just not knowing how your bills are going to get paid. That's my biggest concern: is how are my bills going to get paid? Is my credit going to be affected? My barbers were thinking about buying houses this year, and that's gone down the drain. All the money that we've saved for like the last 2 years thinking about buying houses, especially with this crazy house pricing jumping up. And now we're all dipping into our savings just to pay the bills. The government, the same thing as the First Lady. I've been waiting since January for my CERB. I've been waiting for at least 2 months, 3 months now for my rent subsidy. Everything is on retro. So like the bills are just piling up, and it's ridiculous because I don't see the help. I do not see the help. If I didn't have this money if I didn't have the money in my banks saving money, I would have been out. I would have been totally out. I would have been totally broke. I would have been totally stressed. I would have been bankrupt. I probably would have lost my car too. And it's just, I don't see the help in the government. I don't see the help. Like they say it's there, but being retro to me means that they're going to pay me back. And what if you don't have the money to pay up front? How are they going to, you know what I mean? They're taking 100% away of our income. And then they ask us to pay 90% to 60%. How do you pay any percent when you have no job? It's just,
And
I
I
don't
think
know.
too, I think one of the difficult things, because in certain sectors, like the restaurant sector, they've been able to pivot, and I hope I never use the pivot ever again after this pandemic is finished. But it's in certain industries, they've been able to adjust and maybe do delivery, but with your sector, they haven't been able to. But I'm also guessing that there's still people getting their hair done, right? There's probably like an underground economy happening now, isn't there? Sean?
There could be people out there. There could be people out there cutting hair, but like I said, it wouldn't be safe, because if you're going house to house to house to house, it just wouldn't be safe. It's not a safe thing to do, but it's something that people probably would do because they don't want to lose their house, they don't want to lose their car, they have to feed their kids, they have all these bills. They're worrying about the future, right? So there is a good chance that you have barbers out there, salon people out there, just trying to make some type of living because no one's really helping. And like I said, the retro is like, it's killing you. Every day you're checking the CRA, pending. It's like, you call the CRA is telling you, oh, you got to call validation. You got to call these people. You got to call those people. You're calling these people and nothing. There's no answer for you. You're asking them what's going on. They're telling you they have no answer for you. So it's just crazy that you can't work for you. You can't, like, the reason why we chose this industry is because we like the independence. We like to be able to make our own money. We like to be able to control our life. And right now it's like, it's just not in our hands right now. And it's just disturbing.
And I think another thing that your industry offers is community. People go to the barber, to their hair salon, and you develop a very intimate relationship with those individuals. Have you heard from people within the community that are lacking that connection, and what's happening as a result of lack of that connection, Sean?
Yes, I've actually, before the lockdown, I was talking with the police officers that get their haircut here. I have a judge here, and they were telling me that the community's committed. A lot of kids are committing suicides. People are stressed out totally. People are mentally getting sick because of this. And this is the community that we cut. People are hurt. People don't know what to do next. And it's sad, man. It's really sad. It's hurting our customers. Customers are going all over the place trying to, it's not good at all, man. It's really, really bad. It's bad for the community.
And Norma, I mentioned that, restaurants have been able to pivot and do online or do a patio, but your industry doesn't really have that same kind of flexibility. How have some in your sector adapted to the lack of money coming in?
All we're doing is incurring debt at this point, and hoping that there will be an influx of clients when we are finally allowed to open. But with the case numbers the way they are, there's no light at the end of this tunnel. This tunnel's getting darker. And because of how vocal I've been on this, I receive a lot of messages from salon owners that have been, their businesses have been in their families for generations. I spoke to one gentleman the other day that has a salon in Vaughan that's been open for 50 years, and he is now being forced to close. And these people have nowhere to turn, and they feel like they've been completely abandoned.
And that must be a very desperate feeling.
It's not uncommon. When you look at the conversations I've had with everybody, what Sean was mentioning, everybody can tell you a story about the rent subsidy that nobody's received anything for 6 months. People that were awarded the $20,000 grant during the first lockdown still haven't received it. So going and having a press conference about how they're available and all these facilities and all these options are available for people, they're just not materializing. And that needs to be brought to the light. We are all, the one common denominator with every conversation I've had with people is, while we all adhere to the strict restrictions and we're trying to stay home and make sure that we're not the reason for the spread of this virus, then we look at the press conferences that show the decision making from our municipal government, especially. This time last year, Tory announced the emergency closure of High Park and the banning of any selfies at the cherry blossoms. Now, our case numbers on that press conference a year ago were 1,768. Yesterday morning, our case numbers were 4,750, and he opened High Park and said, proceed with caution. Businesses that are being forced to close at this point are looking at themselves going, how is this possible, and how does this make any sense?
Isabella?
I completely agree with that. It's honestly just so disheartening to see that we've been continuously left in the dust. Like, we are proactive in what we're trying to do to get ourselves and our clients back to our businesses safely. We've implemented every safety procedure they've asked. We've been governed by our health units and following their guidelines. So it just doesn't make any sense to us that we're the ones that are continuously left behind in these decision makings. Meanwhile, we are doing the best that we can. I had a friend, for example, her name is Meg. She owns Ink Factory in town, and her partner ended up taking a layoff when we were allowed in that 4-day time period that they said that we could reopen. Meanwhile, they turned around and closed us back down again. And now they're both out of work. So it just doesn't make any sense to me that they're saying all of these things. They're all false promises at the end of the day. And we're all losing everything that we have for no reason. We haven't even been given a chance at this point.
There's been a lot of back and forth. I mean, this past week, you were supposed to essentially be open until the cases went up again, and then we went into another stay-at-home order. If you could, I'm assuming if someone from the government watching this, Isabella, what would you like to say to those people that are making the decisions?
I'd just like for them to just take a look and see like what the cases are in each region. Like, I can definitely see in Southern Ontario, maybe it's just because of the population density and the fact that all of these other big industries aren't following the regulations that have been given out, that maybe there's a little bit of a boom in the cases there. But up in Northwestern Ontario, we're down under 100 active cases in our city. There's a neighboring community, Fort Francis. They had one active case 2 weeks ago, and they are now put into a gray lockdown. It doesn't make sense how they're making these decisions and how they're just kind of lumping everything into a complete lockdown, and that we haven't even been given the opportunity to kind of prove ourselves and show that we're not the problem. When everyone else was allowed to open at 25% capacity, why were we not included in that?
If you were told that you could open tomorrow, would that help?
It would start to help, but at this point, unfortunately, the damage is done. It's going to take years to financially recover from this. It's going to take a lifetime to mentally recover from this. It's going to take a really, really, really long time to figure this out and to get back on our feet.
Paula, in the clip that we showed earlier, Premier Ford said that his heart goes out to your sector and that he would like to get you open back up. Yesterday, you were scheduled to meet with a representative from Minister Vic Fideli's office, the Minister of Economic Development, Job Creation and Trade. How did that meeting go?
Yeah, so we did meet with one of the stakeholders from his office, and actually the meeting went extremely well. That office in particular, and particularly Minister Sakaria, they've been listening. They've come to visit as well in person to really understand our what we've done. So in terms of adding barriers, and in some salon and spas, there's massage therapy and aesthetics, and massage therapy is open using the same door, the same protocol as we would have with beauty. And so the meeting went well. We have a lot of work to do. We've obviously given them the plan for our reopen, and we are seeking recovery money for our sector. And I echo what the others have said here. Unfortunately, the supports, while we're grateful for them, they're slow, they're backdated. For example, April rent, you can't even apply for until May. And I'm still trying to figure out why we're paying the landlords when we're closed. It's just so bizarre to me that the government has given them 100% of their income, and we have lost everything. It's very frustrating for us as a group. And I think there needs to be a lot of modifications. Look, the government has tried to do their best to get as much money out to a number of people early on. We need to be treated fairly. And I'm really hoping that public health and all of the decision makers are watching this. We are going to hold you to your word. We need a meeting immediately. We are a sector that has been forgotten, and we need immediate help. We are important, and our lives are important.
Sean, I saw you nodding your head when Paula was talking.
Yeah, I just think they need to. I think they need to just come up with a better strategy. I don't see the strategy, and I don't see the strategy in what they're doing. Like, they're locking down, the numbers still go up. They open up, the numbers still go up. Like, I don't understand the strategy. Just like she said, we're paying rent to our landlords. We're paying rent to Enbridge. We're paying our gas, light. We're paying all these bills, and like I said, we're in the red zone and we're in retro, and we're not being paid back by the government. They're the same people that told us to lock down 100%, lock your store down. You're not making any money, and then they don't help us out. And it doesn't make any sense, because not everybody has, like, especially the people downtown. Like, imagine paying $10,000 rent every single month, and you've been locked down for 7 months, and you owe $70,000 in rent, and then you also owe gas bills, and then you also owe this bill, and then you also owe house bills if you have kids. Like, it's enough to make somebody go crazy, and it's not fair, and it's not nice, and you would never expect that from your government. And especially with Ford saying how he cares, I don't know, man. I don't see the care in that. And if he does care, hopefully we do see something immediately. Hopefully he sees us talking about this today, and he understands that we are people, and we're struggling out here, and it's not fair, because we are the community. We keep the community happy, and everything that we do is for the community. So I don't get it. Like, I don't get why we would be treated like this, and it's just not fair.
We only have a few minutes, but some people say numbers talk. And I just found this from Refinery 29. As of March 13th, Statistics Canada reported that the personal care industry, your industry, have been responsible for 47 outbreaks and 401 cases across the country since the start of the pandemic. And it was actually the lowest rate among similar businesses. For reference, food and retail stores have accounted for 634 outbreaks and 2,161 cases. So, Norm, when you do hear that, there seems to be kind of questions around how those decisions are made. And given that infection rates across the province and the country are going up with no sign yet of dropping, if you were in government with lives still at risk today, what would you do to tweak the policy so that we can all stay safe?
I would use logic and fact and the data that they have, and I would close down the businesses that are responsible for this, instead of making us the culprit in this. We've been asked to incur a year-long debt, and we're in danger of disappearing forever. And so, instead of satisfying the public's thirst for a culprit in all this and making it us, let's stop rewarding companies that aren't following restrictions and letting them record record earnings every month. And let's get to the root of the problem and stop this before it gets completely out of hand. Their projections for May are 12,000 cases a day. We've been closed since these things were under 800. We're not the reason for this.
And Paula, I'll give you the last 30 seconds.
Well, I think I would listen to the doctors and really target where the source of the spread is. They've known because they do have the data. And, to support Angela, like if there's really that little cases up there, I mean, you really have to look at this a little bit more regionally. But more importantly, I would like them to be grateful for the fact that we've sacrificed our businesses for a year for this cause, to help the community, to help COVID, to help all of this. And we need a meeting. We need immediate relief. We need them to respond and to make us important. We are important, not just to our own lives, but we do, like Sean said, support the community. And everyone loves their barber or their hairdresser or their esthetician and, their body art professional. We represent all of them, and we want to be treated fairly. Premier Ford, we want to be treated fairly.
Thank you so much for all of your time tonight. We really appreciate your insight, and we wish you best of luck in the next few months. Thank you so much.
Thank you.
Thank you.
With a stay-at-home order in place for every part of the province, it can be hard to get a sense of what's happening in your own region, let alone beyond that. Here to at least give us a sense of their areas in Red Rock on the north shore of Lake Superior, Charnel Anderson, who covers the northwestern part of the province for Ontario Hubs, and in London, Ontario, Mary Baxter, who covers the southwestern part of the province. Welcome to you both.
Thank you.
Hi, Jaya.
All right, Mary, we're going to start with you. Catch us up to speed. What progress has southwestern Ontario made in trying to contain the virus?
Last year at this time, we were seeing a lot of outbreaks amongst the farm worker communities in this region, and it was very concerning. The outbreaks were very large. They were due to a lot of different factors, one of them being congregate living on farms where the living conditions weren't all that great. It was hard to physically distance it, and then there was the lack of personal protective equipment. This year, there's been a lot of work done on it. There's still problems that exist, but we're also seeing some of the benefits of that work. So things like a recent introduction of a program, a provincial pilot to vaccinate migrant farm workers as they arrive in Toronto. And then there's been Ministry of Labour inspections of farm workplaces. And we're seeing a bit of a result. You can see in Windsor-Essex, for instance, their rate of an infection and their outbreaks is very low. Overall in the province, the outbreaks on farm communities is very low.
Now, Charnel, you were on the show just a few weeks ago. We were talking about a spike in cases in Thunder Bay. Those have since come down. Want to get an idea of what those feelings are in the city. Will they be able to keep those down?
In March, if you can remember, at that time, Thunder Bay had the highest rate of COVID-19 per 100,000 people in the province. And so since then, at about the beginning of April, cases have been on a downward trend. So this week, I believe the highest number of cases we had was 13, which was on Monday. And as of Thursday, there were 4 new cases announced for a total of 61 active cases. So we're doing a lot better than we were. However, there are still 10 people currently hospitalized with COVID-19. And so the medical officer of health is worried about, that we may be lagging behind our Southern Ontario counterparts because there are variants here. There have been a number of variants found in Thunder Bay. We're not sure what kind they are at this time. They haven't been identified. But there have been quite a few cases of the UK variant found in places like Dryden and Kenora, and that's in the Northwestern Health Unit. So, it's important that we stay vigilant.
Now, you touched on Dryden. Of course, Thunder Bay is just a very small part of the region that you cover. How about the rest of your region? How are they dealing with cases there?
So we have been seeing some growth in the Northwestern Health Unit. So in places like Sioux Lookout and Emo, there's actually an outbreak linked to an Easter church service in Emo. So right now, in total, they have over 50 active cases of COVID-19. And so the bulk of those cases, more than half, I believe, are in Sioux Lookout. And the medical officer of health there, Dr. Kit Young-hoon, she's concerned and she's telling people, we still need to adhere to these public health guidelines.
Now, Mary, London Mayor Ed Holder said that the city, without question, should be considered a provincial hotspot, but added the extra resources and targeted vaccine rollout are no silver bullet. Now, he was quoted in the London Free Press this week saying, the best way to handle this issue is to stop the congregating, to stop the issues around not wearing a mask, he said. The health unit can do everything it does, but until people take individual responsibility, none of this means a damn. Hotspot or otherwise. Mary, has there been some confusion about hotspots? Obviously a hot topic, but with vaccine distributions as well in London?
Well, when hotspots were first rolled out by the province, they were based on postal code. And for southwestern Ontario, there was only one hotspot identified, and that was in and around Elmer. But what's happened in London is in and around Western University has seen a series of outbreaks in its student population. It's been so extreme that Western has sent students home early. And so in the postal code around that area, there's also a very large student population population, and they've been seeing rates of positive COVID-19 tests there up around 29%, which is like right up at the top of the province in terms of those infection rates, and or testing rates, excuse me, and so that they want to see that area declared a hot spot, and not only local politicians but area MPPs as well have been calling for that.
Charnel, I want to pick up on that. As we mentioned, your region is quite vast. Is there concern that people are able to get to the vaccines in time?
Yeah. So, I mean, what I will say is, none of the regions here have been designated a COVID-19 hotspot. That being said, there does seem to be vaccine clinics popping up, quite often. So there are a number of pharmacies in a number of communities in the Northwest who are administering the AstraZeneca vaccine. But the issue, as is an issue, in most rural communities with a lot of things, is transportation, access to these vaccines. For example, my neighbor, she just went for her first dose of the vaccine today, but she had to go to Nipigon, it's about a 20-minute drive from Red Rock, but she doesn't drive, right? So actually my parents ended up taking her. But, this is a challenge for people living in smaller communities that, maybe they live alone, maybe they don't drive, because you can't just hop on the bus, you can't call a taxi. So, I think one option that would be useful for people in the Northwest would be perhaps a mobile clinic that goes to people that can't go to these clinics.
I actually want to pull up a clip from Thunder Bay Mayor Bill Morrow, who was on our show earlier this week talking to Steve Bacon. Let's have a look at that.
If the medical advice is that the lockdown stay-at-home order is necessary to contain the variant, if that's what's driving the current policy position, then I think we can all accept that. But I think if that is what's driving the policy decision that the province has made, then it needs to be tied to very close plan rollout. Because if Thunder Bay, with our numbers going down significantly over the last 3 weeks, is included in this pan-provincial lockdown because of the variant's potential, increase in the numbers, then I think that we need to be accommodated the same when it comes to the vaccination rollout across the province.
Charnel, he touches on that, but why is it important that Thunder Bay get its fair share of vaccines in good time?
I think he makes a fair point in that if these restrictions apply province-wide, then, the vaccine rollout should also reflect that province-wide approach. Because I think, people in Thunder Bay and the Northwest generally sometimes feel like an afterthought for the provincial government. One example of that would be back in March when we had this spike in Thunder Bay, a number of leaders, including Mayor Morrow, were calling on the province to designate Thunder Bay a COVID-19 hotspot. And, that never happened. However, we did get an additional dose of, I believe, 1,000 vaccines, and the numbers have gone down since then. I will say that Thunder Bay has done a remarkable job in terms of getting vaccines into people. So at least 45,000 people have received the first dose of the vaccine in Thunder Bay, which works out to about 25% of the population. And so that's compared to 15% in the rest of the province. It really is remarkable, and we're on the right track. It's just we need to keep those vaccines flowing in order to kind of keep up this pace and keep the cases down.
Very good. Now, Mary, I want to actually pull up a photo that you took in your neighborhood in southwest London. It's a sign here that says no more lockdowns. Is this any indication of how people are feeling right now?
Certainly, there's a lot of frustrations out there. I spoke to someone else who also had a sign up on his lawn. He is amongst a lot of people in our area, unfortunately, that think that COVID-19 is a hoax. There's been protests. There was one in Simcoe last weekend where hundreds of people turned up. There's rumors of another one that could be happening in Strathroy this weekend. So there's a lot of frustration amongst people in having to stay at home.
Charnel, we have about 30 seconds left. I want to touch on that frustration. Small businesses, they haven't been open for quite a while. What are you hearing from them in northwestern Ontario?
Yeah, I had to check because I didn't even remember last time, businesses were allowed to be open. But there was a period since about December of 12 days, the end of February, 12 days where businesses could be open. So business owners are frustrated. We had a salon owner from Thunder Bay on the program not too long ago, and I think he speaks for most people, particularly in the personal care industry, who have not been able to operate their business for months on end now. And as I said, cases are on the downward trend here, and if things continue this way, you're going to be hearing calls for the province to go back to the regional restrictions.
It'll be interesting to see what happens after this. Charnel Anderson, Mary Baxter, you guys are the Ontario Hub journalists covering Northwestern Ontario and Southwestern Ontario. Thank you so much.
Thank you.
Thanks, Cheyenne.
The agenda this week assessed calls for paid sick leave and debated the merits of political parties in Canadian democracy. The agenda's Week in Review begins examining the province's vaccine rollout.
77.9% of available vaccine doses in Ontario were actually used by the end of last week. 77.9%, which means there's almost a quarter of the doses that are still sitting in a freezer somewhere, presumably, and have not yet been used. Why would that be?
So I think there's a couple things to note there. So first of all, if you look on any given day of how many vaccines haven't been administered as compared to those that have been delivered, we have to look at when those vaccines were actually delivered. We're getting those in weekly shipments. So of course, if we receive 1 million doses yesterday, then it wouldn't be surprising to see a gap of 1 million doses today. The other thing that's worth noting is that we see constant delays in vaccines, unexpected delays of when they're actually going to arrive into the province. And that means that if we don't get the vaccines on Monday and they end up coming on Thursday, that we'll have 300,000 or 400,000 vaccination appointments that will not be able to be honored. And so having around 3 days of vaccines to be able to use for those in case there is a delay is prudent. And that, given that we're doing around 100,000 vaccines a day, would end up being around 300,000 vaccines if we wanted 3 days contingency. The other thing that I'll note is that that figure of 77.9%, while it does show that there is a gap between that and 100%, it is the second highest administration across the entire country of all provinces and territories, save for Saskatchewan, and is comparable to that in the United States, which is a paragon for vaccination administration.
So don't compare me to the almighty, compare me to the alternative.
Well, I think we need to look at what's feasible. Absolutely, we want to be vaccinating as many people as we possibly can and administering every single dose that we get. But if we want to look to Ontario to say, are we failing as a province, I would say this appears to be the norm across every other province and territory, every other state in the United States, and every other jurisdiction that is doing this.
All right, let's move on to the Ontario Liberal leader, Stephen Del Duca. He had a news conference earlier today in which he called for all education workers, period, full stop, not just those in hot zones, but everyone to be vaccinated. And the thinking was you could get it done this week because, of course, this is March break week. Even though it's not March, it's April, but it's March break week. This is the week the kids are off. When it comes to, Marie, I'll get you to start on this one. When it comes to protecting teachers, students, caretakers, principals, everybody in the school system, what's the best way to do it now?
I think this is a great opportunity to use empty schools to vaccinate teachers. We've seen that work in other provinces and also across the U.S. as well. I am concerned about the length of time that it's taken to get vaccines to teachers, given that there isn't a province-wide policy for schools to be closed right now. So this is very, very concerning, especially in the context of this exploding number of variants of concern. We're starting to see that that is affecting children in other areas, in Israel and Italy, across the U.S. as well. And so I don't think we can sort of look at the data and say, historically, throughout the past year, SARS-CoV-2 hasn't affected children, so that's okay, we're not going to prioritize schools. Right now, we have a pandemic of variants. So it is really, really important that we focus on teachers and everyone else that works in a school.
Sabina, is it possible to get everybody during this week when the schools are shut down, to get everybody who needs a vaccination vaccinated?
Okay, so the virus works 24/7. It does not take a break. And so our response has to be immediate. It has to be urgent. Every vaccine that's sitting in a freezer right now that is not going in someone's arm is a life that could be saved. So absolutely, we should be doing everything. We should be having 24/7 clinics, and we need to be vaccinating as fast as we can.
All right, let's move on to long-term care. You may know the National Post columnist, Financial Post columnist Diane Francis, who did a piece recently on whether the vaccine should be mandatory for those working in hospital and long-term care homes. And here's a little of what she wrote a few days back in the Financial Post. She wrote, "Governments cannot allow worker rights to trump patient rights. All public-facing healthcare providers should be required to be vaccinated under the threat of termination. Care homes should also require all staff and contractors to be vaccinated as a condition of their employment. The healthcare system is supposed to look after the sick and the vulnerable, but it can't do that if reckless medical professionals are exposing patients to COVID-19. Okay, Maxwell, do you agree or disagree with what she has suggested ought to be done here?
Yeah, I think mandates for vaccines can be ethically justified. Of course, we have them for schools in Ontario. When I worked in hospitals, I had to show that I was vaccinated against certain pathogens. I think that we need to certainly think about the balancing between public health benefits and individual freedoms.
You just heard Premier Ford say, we don't need to do that. There's already a federal program in place, still with $750 million in place. Who's right here?
I think that we just have to clearly say that the Premier is wrong here. There are so many differences between that program and paid sick leave. To apply for the CSRB, it takes 7 steps between applying for it and getting it. If you have paid sick leave, there's 1 step. You call in sick, your paycheck doesn't change. And I think it's really important to reinforce here that this is a workforce that is low wage and cannot afford either the uncertainty, which accompanies that federal benefit in terms of you're not sure whether you'll get it or not, and also can't afford the wait times. So those are 2 crucial differences between the federal benefit and paid sick leave that make it less likely that people are going to access it. And we have very good proof of how that's not happening. The Premier himself stated that there is still $700 million left there, and we are still seeing huge amounts of transmission of the virus in workplaces. So I really think we need to take a different approach, and we really need public policy to put no barriers in between people's ability to take care of their health, to take care of the health of their coworkers and the public at large.
Let me just clarify a couple of things. One of the allegations that has been made is that there's still $750 million in this federal sick leave fund because it's undersubscribed. People think it's too difficult to get, so they don't apply for it. True or false?
Yes, that is true in terms of the estimate of the amount of take-up is the estimated the take-up rate, my apologies, the take-up rate is much slower than had been expected. And what we assume is that the difficulties in accessing it and the uncertainties associated with it are the reason for that.
Now, Marcy, one of the reasons that Premier Ford has been reluctant to bring in the kind of sick days policy that Sheila just enunciated is that he thinks business are already suffering enough and that they cannot be expected to take on the financial responsibility of yet another program when they're already on the edge of a cliff. What's your view on that?
Well, certainly, I mean, we're in a new terrain here, Steve, right? Like COVID, the realities that COVID has laid on government, they have to balance the protection of human life as well as fairly support businesses who, again, have been making incredible sacrifices throughout this pandemic and have been hit, some of the hardest after, those who lost their lives. And I think that what everybody wants is consistency, and it's simply to know what supports they have, what parameters business can work within, what's on the horizon. If the government chooses to support paid sick leave, then, business can factor that into their plans. But really, it's all about consistency and consistency in our approach to keep people safe and when the time is right to really reopen the economy.
But Daniel, I presume before the pandemic hit, that if you were sick, you called into your employer and you said, I can't come in today, and you would still get your salary, and the business in question would be responsible for paying that salary. We're post-pandemic now, or into the pandemic now. Is it your view that the expense of paying for sick days for employees who can't come in because they don't want to infect their colleagues at the workplace, in your view, who should pay for that now?
Look, Steve, ensuring people during a pandemic can afford to stay home is both, it's a really important point. It's both morally the right thing to do, and it's economically sound as well. And when a worker protects themselves, they're protecting their colleagues, they're protecting their employer, they're safeguarding the business and the community by extension. So our position on this is that businesses, particularly small businesses, simply cannot afford the additional financial responsibility to fund sick leave at this time, which is why we support the notion of a temporary paid sick program that is paid for by government. And Sheila just now did a great job of explaining what some of the shortcomings are of the federal benefit program. But just as other programs and benefits that have been rolled out over the last year have been tweaked and improved or amended to fill in the gaps, we don't see any reason why the very same can't be applied in this instance as well. And so, we hope to see both the province and the federal government, work together to explore, either a reform of the current benefit or the implementation of additional support, so that when people can stay home, when people need to stay home, they're able to do so safely, and they don't need to choose between following public health orders and being able to put food on the table.
Without a party system, people don't know who they should vote for, and they don't know who's accountable for what. And so let's take the first piece of it. All of the data I've ever seen indicates that about 5% of Canadians really vote on the basis of their local candidate. And that tends to be in rural areas where people know their local candidate. In most parts of the country, people don't even know who the candidates for the parties are. They vote either for the leader or for the policy program of the party. And that is how all of what's going on is decoded for them so that they can make a choice about what they want. Then similarly, if I'm in Toronto and I don't like what's going on, can I blame John Tory for that? He's one vote on the council. The accountability is so obscure, I don't know who to blame. Whereas in a partisan system, when I'm unhappy with the government, I know exactly whose neck to choke. And so I think for those two reasons, Susan's done a lot more thinking and research about this than I have. But I have trouble seeing how it would work and whether it would be desirable for it to work.
Okay, we'll get some more feedback on this and then let Susan respond to what she's hearing. Sean, you're a guy who back in the day spent some time in partisan politics working for Conservatives. Can you imagine a political system in Canada that doesn't involve partisan politics?
Well, the short answer is no. I think that this conversation about problems or weaknesses in our democracy is terribly important. But I'm not sure the solution is to discard parties. In fact, I think there's a persuasive argument, in fact, that we ought to have more parties. That one of the problems with the current system is that these large brokerage parties aren't bringing expression to large minorities in our country, whether it's hardcore progressives, whether it's pro-life voices, whether it's those who have misgivings about Canada's immigration system and yet can't find expression in our current mainstream politics. So I could go on, Steve, but I think in short, I've increasingly come to view, and this has been through a kind of period of introspection, prompted in large part by the rise of political populism, which is obviously has various complicating factors, but at some level represents a kind of rejection of the lack of representativeness and responsiveness of modern democracy. And for me, it's made me more of a small d Democrat, and in turn, I think increasingly persuaded by the need for something like proportional representation, which would not lead to fewer parties. It would actually lead to more parties. It would be a less efficient and messier politics, but ultimately a more representative and responsive one. And for me, that's one of the major takeaways of the political disruption of the past several years.
David Moskrop, where are you on this?
Well, if parties didn't exist, you would have to invent them for reasons that David outlined. And incidentally, I happen to agree with Sean on proportional representation. I would love to see some socialists in legislatures. Our parties are all fundamentally liberal, and that does, I think, close out a lot of debate that we should legitimately be having. But if you look at the history of jurisdictions who have tried to do away with parties or to sort of mitigate their force, parties creep back up anyway. The United States is a good example of this. The framers of the Constitution in the United States were weary of what they called factions. They didn't love the idea of parties, but parties crept in anyway because they perform the functions that David talked about, which is they sort of consolidate voices and they allow for accountability. And so the parties form a necessary part of our system. I don't think parties are the fundamental problem. I think parties done poorly is the problem. I think parties that are too leader-centric, parties that are fundamentally identitarian and toxic because of it, they perform a sort of toxic identitarian partisan role rather than a sort of partisan sorting role. And they end up being anti-democratic in that way, are part of the problem. We could do parties better. It doesn't have to be either or. It can be, can we imagine a different sort of party system that works and includes people and is more functional? And I think we can. So I do think we need party reform, but I don't think we should do away with them, nor do I think we could, because they would just sort of reform anyway.
That's just some of what we covered this week on The Agenda. For more, including the full conversations, you can visit our website, tvo.org, our YouTube channel at youtube.com/theagenda, or our Twitter feed, twitter.com/theagenda. And that's it for this Friday, April 16th, 2021. The federal budget comes down next week, so we'll be watching out for that, and whether a new childcare program is included. Also, for Earth Day, we'll weigh the pros and cons of electric vehicles. I'm Nam Kiwanuka. Thank you for watching TVO and for joining us online at tvo.org. Have a great weekend, and we'll see you on Monday.
Ontario Hubs are made possible by the Barry and Laurie Green Family Charitable Trust and Goldie Feldman. And by viewers like you. Thank you.